Welcome to our HR Work-Life Benefits workshop on family medical leave basics and paid parental and paid elder care leave here at the University of Kentucky. We are glad you joined us today for this workshop. Our presenters today, we have Chris Dudley. He is our HR Manager in Leave Administration and Remote Work. We have Becky Thomas. She is our Associate Provost for Faculty Development with the Office for Faculty Advancement. And we have Gail Carbol. She is our Acting HR Benefits Director. And I'm Azetta Beatty, the HR Manager for Work Life and Benefits. All right, so in today's workshop, we will be covering primarily everything related to FML. So we're going to be giving you an FML overview, including some FAQs, frequently asked questions. We do ask that if you have very specific questions about FML, you are always welcome to reach out to our FML office or our Office for Faculty Advancement. We're also going to be talking about a few additional leaves that sometimes are impacted by or taken with FML, including paid parental leave, paid elder care leave, TDL, temporary disability leave, and the TDL Well-being leave. We're also going to just walk you through the FML leave processes for faculty and staff because those processes are different. And then we're going to talk about sometimes how FML can potentially impact your benefits and your pay. And we're going to round up with just talking about some of the work-life support options that we have for our caregivers. To kick us off, I love this little poem, this little quote rather. It says, "The most important time in the world is the time you make for yourself." So the most important time in the world is the time you make for yourself. Just want to remind you of that. All right, so we're going to go ahead and get started talking about our staff processes.
Well, good afternoon, everybody. As Azetta said, my name is Chris Dudley. I'm an HR manager in the leave administration area. We're going to take some time just kind of talking about family medical leave, what it is, what it isn't, things of that nature. So the Family Medical Leave Act has been around since 1993. This is something that was developed by the Department of Labor. What this allows one to do is to take unpaid job protected leave for specific family members and or medical reasons. Now, what the FML does entitle somebody up to is up to 12 weeks leave in a 12-month period. Now, the university uses a rolling period of time. So everything always backs up to when somebody uses FML for the first time. So if somebody started, we'll use tomorrow, this would be a simpler date. From April 1st, 2026, they would have 12 weeks through April 1st of 2027. And so we do that. That part does get a little challenging sometimes for some folks. There are several ways that one can take FML. Continuous is just that, is a continuous leave. Someone's having surgery, maybe they've had a baby, something like that. They're going to be out again, say April 1st through May 1st, continuously. Or there may be intermittent type of leave, and that is somebody has approved FML for some type of flare-up, or maybe they need to take their parent to dialysis or something like that. So it's going to be used intermittently throughout the course of the period. Now you will see if you get your letter from the FML team, something's called frequency and duration. So a lot depends on what the treating healthcare provider tells us. They may say, okay, this individual needs to be off 2 times per month for an episode, each time lasting 1 day. So that is what we have to go by what the healthcare provider would provide to us. And another way to take FML is a reduced schedule. And that is just that. So if somebody needs a reduced schedule, we work with them. We also work with the department, make sure everybody is on the same page when it comes to that. Eligibility for FML. There's really two tests when it comes to FML eligibility. They have to be at the university for at least 12 months. Now, that doesn't have to be consecutive months, but it does have to be over the last 7 years and have to worked at least a minimum of 1,250 hours for the previous 12 months. So um, our team actually does the calculation of those two eligibility tests. If you're working with one of your team members, um, you can kind of guide them that this may be something they do, but that the official certification has to come from our office on those two eligibility tests. A couple things that an employee may get or a supervisor may get. The first one's we call the 15-day memo. So when somebody has a potential qualifying event, so you know somebody's going to have surgery or their significant other, something's going on with them. They've been off work for 3 consecutive days. They may have been in a hospital, things like that. We want to give them this memo. All it says is, hey, we recognize that you may have something going on. And the reason we call it the 15-day memos, they have 15 days to turn it back into us. So you would fill it out, the employee would sign it, and that way we have a record that they have been notified of the qualifying event, and then they need to get their FML turned into us if need be. Oh, at the bottom, I'm glad this thing pops up. It talks about how do you calculate 15 days. We do include weekends unless there's a federal holiday in there. So that's used for in case they dropped it in the mail or something like that. Next one is the actual FML application. You can find this out on the UK website, and I would encourage people to go out there and get that if need be. The Department of Labor does change some of the wording and some of the regulations occasionally, so we try to keep our applications as up to date as humanly possible. Um, but anyway, so it's roughly a 4-page document. First couple parts filled out by the employee, then part two is filled out by the healthcare provider. Typically, the healthcare provider will fax that directly into our office. We have two secure fax machines that those things come into. We also been advising people, especially here at UK, if they have access to MyChart, ask their doctors to put a copy of it on their MyChart account as well. Reason we found out is sometimes the employee never sees what their healthcare provider puts on their FML until they get their notification from our office. So if there's ever some discrepancy or some question, that gives the employee an opportunity to go back to the healthcare provider and say, hey, are we sure about, what they wrote? So it's always a nice thing for them to have. Or if, for some reason, their healthcare provider says they sent it to us, we never received it. This gives the employee the ability to grab a copy and get it to us as well. Now, there's some FAQs that we have seen. We get a lot of these type of questions all the time. What other types of leaves are impacted by the FML? Well, so FML by itself is unpaid leave. The university and most other employers requires one to use any vacation time, TDL or sick time, or possibly even holiday times. We'll talk a little bit more about the elder care and the parental leave in a couple of slides. But these are I refer to them as other buckets of time that one can draw from while they're out on the FML. Types of concerns I can use FML for. The big ones that we see, of course, I talked earlier, is birth or adoptions, any type of illnesses, um, appointments, care for a spouse or a child, or one of their parents. Do I always get approved for FML? Unfortunately, no. Again, so the first couple, like mentioned a few minutes ago, the two big tests. So they have to be here both past the 1 year and the 1250 when it comes to hours. So if they don't meet one or both of those tests, they would not get approved. If they've already had FML this year and maybe they've used up their full 12-week allotment, or maybe they used, say, 8 weeks earlier this year for something and they need more time, they won't get denied FML, but they'll only get approved up to that additional balance. So in that case, if they used 8 weeks, they only have 4 weeks remaining to use. Can I extend my FML beyond the 12 weeks in a year if I have the TDL time? You cannot extend the FML. That's federal regulation, so we can't go past that. There are some folks that have been here a long, long time and have a huge TDL balance. Could they use that? Yes. We always tell them to work with their department and make sure that they're all in agreement to that. Intermittent leave on FML. Again, as I mentioned earlier, that's used more sporadically. They want to do that. If you're calling off work, you're still required to follow your department call off procedures. I know some areas, especially over in the hospital, some of them have maybe a 2 hour window. So if your shift starts at 7 a.m., you'll be required to call in before 5 a.m. So you got to make sure you do that. And also let them know that it's FML. So just calling in saying I'm sick when you do have an FML coverage, you need to let those areas know so that they make sure they code that correctly and there's no missteps along the way. Can I take leave if I do not have accrued leave time? Under FML, yes. So again, if you have if you have approved FML
I'm just
and
sitting here listening about it. I'm not like,
okay, somebody needs to mute. I'm sorry.
no, seriously, let me know if you need anything, Patty. Okay. Days off, like, let me know, okay? I will. We're trying to figure out. I know.
Thank you. Um, if you have approved FML, like I said, that time is unpaid. So if you have any accruals, you're supposed to use those accruals during that time. But can you have that and not have any accruals? Yes, you could just be going to a no pay situation. Can I or should I work while I'm on FML? This is a tricky one. We get these questions quite often from folks. If the FML is for yourself, so if you had surgery, the intent is you should not be working. Then you should be at home or wherever recovering from that event. Now, if you are a spouse and your significant other, let's say, had a baby or maybe they had surgery, um, could you work a little bit, check emails while they're, sleeping or maybe they're at PT? Very possible. So everyone's sort of on a very unique situation, but really the bottom line is if the FML is for yourself, the simple answer is no, you should not be working, especially if you're out on a continuous leave. Um, what happens if the FML is not filled out and returned within the notice period? Um, we really encourage folks to work with their provider, make sure that gets turned in. We can't approve FML until we actually have the paperwork. Now there are exceptions to that, if somebody's in the ICU or something like that, we can work around that. But your run-of-the-mill FML, like I said, we really need to make sure we have that paperwork in hand so that we can review it, we can process it, make sure it meets all the criteria and things of that nature. Does FML leave automatically get added to my leave in SAP, or do I need to submit it after it's approved? Really depends on where you're at. So if you're on the UK healthcare side of the house and you're about on FML continuous leave, my team will enter that into the UKG or the old Chronos system. If you're on the campus side or under SAP, we'll notify your business officer or your payroll type of person, and they'll enter that in there for you. Okay, paid parental and paid elder care leaves. So these are, I still call them relatively fairly new leaves that the university offers. I believe it was last year we expanded the paid parental leave from 2 weeks to 4 weeks, and the paid elder care from 1 week to 2 weeks for qualifying folks. Um, Again, all that you're really required to submit is the FML application. So you would check it for your parent if it was going to be the elder care, or you would check the box for birth of a child or adoption if it was under that. The page that's up on the screen right now is only for those who do not qualify under FML. So the paid parental and paid elder care leave programs are eligible to folks on their first day of employment with the university. So if somebody is new to your group and they've only been here, let's say 4 months, and they're ready to have a baby, uh, they would go ahead and fill out the paid parental leave form here and submit that. There is no need for people to turn in both FML and this application if they're FML eligible. So the reason we have this one is we do need a paper trail. We do need it to be signed by the healthcare provider so that we know what's going on with that. Eligibility and hours. So both the parental and elder care leaves have the same eligibility. So this is available to regular staff with a zero point 0.5 or higher FTE. It does not apply to faculty, uh, folks that are in WEP lines or postdocs. And as mentioned, it is available on the first day of employment. The paid parental leave program, like I said, 4 weeks based on their FTE. And those hours are good for 6 months, and it can only start at the date of birth or adoption. And the reason we give 6 months is sometimes, especially when it comes to adoptions, uh, the parents may not get the baby exactly at the date of birth. They may have to still go through some of the court proceedings and some other things. And this gives them a big enough window so they can enjoy that 4 week opportunity as well. The paid elder care leave is, like I said, good for 2 weeks, also based on person's FTE, and those hours are good for 1 year. So again, if they started tomorrow, they would go April 1st of 2026 through April 1st of 2027. We get a lot of questions about can I get an additional award because both of these programs are awards. Um, the simple answer is yes, but. So by policy, to get an additional paid elder care award, it either has to be for a different parent or if it's for the same parent. The serious medical conditions have got to be different and well defined on the FML application. So that's part of the reason we also ask for that, to make sure that that goes on. So if there's ever any questions about that, feel free to reach out to our office and we can help you kind of work through that as well. On the screen is just quickly out of SAP to kind of show how the hours would show up. So the top part, the bottom shows the parental leave at 144 hours. So you'll see the entitlement, what's remaining, what's been requested. Uh, and then at the bottom shows the elder care leave. So it kind of works the same thing. I will tell you, if you're over on the hospital side, we load all the hours through SAP, and then SAP has to transfer those hours over to UKG, the Chrono system. There is sometimes a lag in those two systems talking to each other. So um, we get calls occasionally. People are like, I haven't seen my hours populate yet over in the UKG system, but I can see them in SAP. So we have to work with workforce management to make sure those get brought over, and then you can have them applied to your time card appropriately. Want to use FML, TDL, well-being. FML, again, the basics of it is chronic or long-term type of situations or birth or adoption. Um, Maybe also some reoccurring intermittent caregiving for a qualifying family member. And sometimes we get it for military leave. We don't get a lot of those, but that's always a possibility that when FML comes into place. The paid parental and paid elder care. Again, these are new buckets of time to draw from. The intent is to use those so that one does not have to use all their or much of their accrued vacation or their own personal sick time while they're out. And those are to be used while you're out on FML. When to use the TDL or the sick time, again, that's more occasional short-term illness for yourself or a family member. And so this may be, like I said, more short-term. Somebody's out, maybe they got a stomach bug, they'll be out for a couple of days. They want to use that. Then finally, when's to use their TDL well-being days. Pretty much any time that somebody uh, likes to use that. So we see a lot of issues in the spring and some other times. Um, we've seen people use it for different things. I have one of my colleagues is a big gardener, and she likes to use her well-being days when she starts getting her garden stuff ready. She'll take a couple days off, or she'll take a 1 day off and make a long weekend out of it, and start her planning. Have others people. I believe Keeneland starts this week, so there may be somebody who wants to take off and go to Keeneland on Friday. But just work with your manager and enjoy your time off. Some people may do something, or they may just sit on their patio and read a book. So that's all used for anything that's used for self-care, fun for yourself, and things of that nature. Let's see here. FAQs for the paid parental and paid elder care. When can I start leaving these options? Again, they're available to employees on their first day of employment with the university as soon as those hours load. So we have to work with IT to actually create the new leave quota. That takes a little bit of time. Like I said, and they will have a stop date on both the paid parental and the paid elder care leaves. Um, Again, if use the example of April 1st, um, so you can use it from, anytime from April 1st forward through that where that end date is. If you try to go in and use it, let's say put in for March 25th, you'll get an error message that says that you don't have those hours available yet. It has to be on
Why
or
can I not
past
hear this?
on or above that that start date. Can I work while I'm on these leaves? Um, Again, these run concurrently with the family medical leave programs. So again, if you're out on parental leave, um, if you're caring, should not be doing a whole lot of work. But we can review, like I said, each one on a case-by-case basis. Let's see here. Again, I think we've already kind of talked about if it's not turned, the application is not filled out and turned in. We talked about those. Elder care leave is only for one's parents. It's not for spouses or in-laws. Can intermittent leave be used for prenatal and elder care doctor appointments? Absolutely. And can I use TDL time instead of FML for parental, or I'm sorry, prenatal and elder care appointments? Yes, you can.
Okay. Hi, everybody. I'm Becky Thomas. As Azetta said earlier, I'm the Associate Provost for Faculty Advancement, and I'll talk a little bit about the faculty-specific processes. So our faculty FML policy is different in a few ways from the staff policy. There's a link on the slide that you can use to find the faculty-specific FML policy. In general, I would always point you toward that website, ofa.uky.edu. From there, it's pretty easy to navigate and find the policy that you're looking for. So faculty leave requests are handled by the OFA, the Office for Faculty Advancement, not by HR. That's one of the differences. Also for faculty, we don't have separate policies for parental and elder care leave. It's all encompassed under the FML program. And faculty members don't accrue sick leave over time. As soon as a faculty member starts, they have a lifetime balance of 6 months of temporary disability leave, TDL, that's available immediately on start date. Faculty members who are requesting TDL or family medical leave should submit their request directly to OFA. And there's the link to our portal. We process that within our office. Don't send those requests to HR. If you do need to fax them, please use the fax number there. That's, again, only available to our office, so you can securely fax to there. Ideally, though, you can use our web portal that lets us track the documents more easily. We can approve, we will communicate directly with you. We will notify your supervisors and staff support about the leave parameters, but without sharing the medical provider form with them. We do have a site within the OFA web area that's specific to faculty leave of absence policies, because again, they are a little bit different given the way faculty leaves have to work around semester boundaries and so on. Our office email is there at the bottom of this page. Please feel free to reach out to us by email or by phone. We're happy to address any questions. And we do have a few frequently asked questions. Where are the faculty leave balances kept and monitored? Currently, those are kept and monitored within the individual colleges or departments. So you have a faculty advancement staff or faculty, perhaps an associate dean within your college, and they'll be able to answer your specific questions about those leave balances. How does extended parental leave for faculty work since they don't accumulate TDL? Well, you don't accumulate TDL, but you do have that TDL balance that you start with, the 26 weeks once you start working. And that, again, that's a lifetime balance for TDL. So if a faculty member did need an extended parental leave, they could continue to use leave that they qualify for, whether that's TDL or if they're 10, 11, or 12-month faculty and have vacation time, that could be used as well. So for communicating about the specifics of intermittent FML usage, again, that would be the faculty advancement official staff member or associate dean within your own college, because they'll be the ones who are tracking. You should communicate with your supervisor as well. This looks fairly different for different kinds of faculty across the institution. In healthcare, for example, if you have clinical shifts, you certainly would need to make sure that the folks who manage the clinic are aware of that. So please do keep in close communication with your supervisor and with the staff who track your time. If a faculty member uses up their entire 6 months of lifetime TDL due to health issues, do they have more TDL in the future? No, it's a lifetime balance. So once you've used it up, you've used it up. There are other kinds of leave available potentially. It may be unpaid leave. There may be some vacation time that can be used. Again, I would refer you to the OFA website and to the faculty leave policies page within that.
Okay. Hello, everybody. My name is Gail Carbol, and I'm going to talk to you about the impact on your benefits and pay while you're on family medical leave. So, first of all, if you have questions, please feel free to contact our office at any time. You can contact us with the number shown here, the 9519 option 3, or email us, or you can contact our Solutions Center. We have an HR Solutions Center that's available at 257-9555. If you plan on reducing your hours or taking unpaid weeks off, you'll want to ensure your paycheck will cover your portion of the benefits, so your employee contribution while those earnings are reduced. If you receive the health credit, and that's if you're working 0.75 FTE in a regular position or greater, you will continue to receive that as long as you work it just 1 day a month. Arrangements can be made to take premiums before you leave if you know that you're planning a family medical leave and that there's going to be a portion that's not paid, or they can be caught up when you return. And then you're also going to want to consider NPM or broker for voluntary benefits and the payment for those. NPM, we have on the slide here, consider NPM for short-term disability. I do want to call out that, and I just had an email today asking, it was from a person who's expecting their first baby in September and wanting to know how they can sign up for short-term disability. Well, sign-ups, if you're not a new hire, are only during open enrollment. So this year, last couple of weeks of April, first week of May, and it's effective July 1st. If you already have what's considered a pre-existing condition, so you're already pregnant, that pregnancy would not be covered. Now, future pregnancies will be, and it is a great idea to pick up the plan at a relatively low cost to have some additional coverage, especially if you're a newer employee and you don't have your TDL bank built up to have those days paid. Next slide. I did want to mention NPM's contact phone number to pay for your benefits is 859-223-4973. So if you have voluntary benefits, they can bill you directly to your home if you're not going to be in a paid status. We can also bill you directly to your home. However, if it's a dental or a vision or a flexible spending account, you lose the ability to pull those deductions pre-tax. So you're better off pre-pulling or pulling those deductions when you return. So we've got the questions. What UK benefits may be impacted by family medical leave? Really, they're not impacted. While you're on family medical leave, you are eligible for all benefits. It's just a matter of if you're in paid status or not, and if you'll be able to make the insurance payments. Will I lose my insurance if I enter unpaid leave status? No, you won't. The only way you'll lose your insurance is if you don't make payment on it. How do I pay my benefit fees if I'm on unpaid family medical leave? Well, we mentioned this, having the deductions taken from your paycheck after you return or before you leave, or you can be direct billed and have those pulled out of a checking or a savings account. Will the family medical leave impact my retirement payments? Only in that, how do I want to say, it's a percentage of pay. So if with the matching plan, the 5% is based on how much you're paid. So if your payment is reduced because you're in unpaid leave, then of course the 5% is going to be on that reduced amount. If it's a voluntary retirement deduction, you've selected a fixed payment, that payment will remain the same. But again, you can either have it pre-deducted or deducted when you get back. You can always stop those payments in a voluntary contribution for retirement as well, and then restart them. Can short-term disability be used with family and medical leave, elder care, and parental leave? Short-term disability can be used with family medical leave, but it is on your own disability. So technically, you're probably not going to have it when you're on elder care or parental leave because you're the healthy person caring for others. But if you're on your own family medical leave, yes, and for birth of a child, yes, you can definitely use your short-term disability. There's two different plans that they offer. They offer one with a 2-week elimination and one with a 30-day elimination period. What that means is, let's say it's a birth of a child and it's your average everyday birth, 6 weeks is what's considered normally that you are disabled. So the first 2 weeks of that 6 weeks, you would not receive a short-term disability payment, but the 4 weeks after, you would. So I would recommend if you're choosing short-term disability to cover you while you're having a child, I would take the 2-week elimination period. Are there any others? All right.
All right, thank you, everyone. So now we're going to transition and talk a little bit about our caregiver services that we offer you here at the University of Kentucky. So when you think about a caregiver services, we do offer services for our parents. It could be related to childcare or childcare resources or just things that you may need as a parent. And then we also offer our elder care services. And we have an elder care specialist, Hazel Tyshin. She's on a call with us today, and she's our specialist that can consult with you confidentially about your various elder care needs. And so through these consultations, we do customize them for the individual. So depending on your specific case, your specific need, we will talk with you about that and help you find the resources that you need to support you. In addition to the consultations, we offer regular workshops through each month, as well as support groups. We have additional events. Sometimes we do outreach to departments. So if any department wants us to come and speak to them, their team, we could do virtual or in person and just share about the resources. We're happy to do that. We also have different handouts that we can send over if that's easier. And then also, of course, our services are for UK faculty, staff, and retirees. Sometimes people don't realize that retirees get to benefit from these services as well. So, looking a little bit at the elder care services, we can, Hazel can assist you if your family member lives someplace other than Kentucky or even on the other side of Kentucky. So, it's good to note that it doesn't matter where your family member lives, that she can assist you in connecting with and finding resources to support you and that family member. She also has a monthly newsletter and blog, and she covers a variety of elder care aging related topics. And you're also welcome to join her Facebook group and her Teams group. That's where she posts a lot of um, articles and advice and upcoming events and things like that. And we host a virtual dementia tour at least once a year, and that is an experiential, hands-on opportunity to kind of what is walk in the shoes of a person that's experiencing dementia. And so if you are caring for or assisting a loved one that is experiencing dementia, you definitely might want to check that experiential activity out just to help you understand what they're dealing with. And so that's a little bit about elder care. When we talk about our parenting and our child care side of things, we do have what we call the Working Parents Network. And you are welcome to join that group by joining our Teams or Facebook group. And also, I post articles about just parenting related things that, dealing with child care and raising a child at various stages, and things for yourself, like self-care things that parents need. And then we have a referral network called Big Blue Family Care. That's where you can submit an online form and request a sitter, like a child care sitter or a pet care sitter. And typically these are occasional part-time, but we do have some people that ask for full days sometimes as well. And summer care, so nanny, full-time summer, winter break, things like that. So if you are in need of a sitter, occasional or otherwise, oftentimes parents will use this service for after-school care as well for their school-age children. So there's an online form where you would submit the details of your request, and then we'll send you some referrals, and we recruit UK students to be the providers. In addition to that, we have information on our website related to lactation support, breastfeeding support. There's a list of all the lactation spaces that UK hosts on campus and across other locations. And we also have a newsletter that we send out and offer resource fairs, such as a parent resource fair in the fall and a summer camps fair in the spring. And we offer workshops every month as well. So, in addition to these two items related to our caregiver support, there are some other well-being opportunities in the areas of mental health, emotional health, physical, nutritional, and financial health as well. So, I definitely encourage you to check out our website, which is our work-life well-being website, and you will see all of these resources available to you. So just want to, as we start to wrap up a bit, remind you that we are all here to support you and guide you on this journey. And we do have information here about the contacts in our FML office, and you're welcome to reach out to them. They have an office email. You can email your question there, or you can email one of the contacts in the office, and they'll be happy to assist you. And then on this slide is just list websites related to everyone on the workshop today, including our Office for Faculty Advancement, our HR benefits, our work-life well-being, and our workshops. So now we're going to transition, and Hazel is going to walk us through questions that she may have received in the chat today.
Thank you, Azetta. Some of these things may have been answered, but we're still going to address them one more time. Can the FMLA application be amended or updated as treatment plans change?
Yeah, that happens all the time.
Okay. Is the 15-day notice required to be given?
Yes.
Is it only unpaid if they don't have the TDL built up in their time bank? Example, if they have 12 weeks worth of time and the doctor says 12 weeks is needed, will they be able to be paid that whole time?
Yeah, so by university policy, if you have time in your accrual banks, you have to use that. You can't go into like a no pay and still have time. So if you have all that time in there and you're out for the period of time, yes, you'll stay on a paid status.
Okay. Are the FML leave dates continuous, intermittent, entered by the department or employee or the leave administration office into the system?
Depends on which side you work at. So if it's continuous leave for UK healthcare, one of my team will enter that in. If it's intermittent leave, that's done by the individual department. Continuous on campus side is also done by the manager or their business partner or payroll type person.
And
So,
for
okay, are there,
faculty,
oh,
sorry,
go ahead.
just
Go
to
ahead.
jump in, for faculty, it will be whoever in the college manages the faculty database entries.
Okay, are there mechanisms in the system to track faculty TDL besides doing it manually?
Manually or not is a question I can't answer, but it's done within each college or department. So
Okay.
you should talk to your local folks.
Okay. How far in advance do you recommend that an application be submitted prior to expiration of a currently approved elder care leave window so that there are no gaps? Or do we need to wait until one expires before submitting for another year?
That's a good question. I mean, we can't enter anything into the system. System will not allow us to enter anything in until after that end date. So I would say try to balance it as close to that end date as reasonable. We look at what's on the FML application and also what's on the other paid elder care type of leave and see where they balance out. But most people apply after the end date's already gone through.
Okay. How far in advance of maternity leave do we need to submit the request for FML? Do we wait until the baby arrives to submit it?
No, you want to get that in early. So I always tell people get in it as reasonable. We'll use what's called the estimated due date. So if they're approved, we'll do a tentative approvement. If the baby comes early or the baby comes late, just notify the FML office and we can adjust from there.
So Chris, this one's, we've got this kind of ask in two directions. Can you use FML for a parent and use paid elder care leave?
Elder care leave is not for, I'm sorry.
Okay, go
Say
ahead.
that, say it.
It says, can you use FML for a parent and use paid elder care leave? The other question is, can we take or have elder care leave and FML, or is it one or the other?
Well, the paid elder care leave runs concurrently with FML. So we need to have both of those. But yes, you can use the elder care leave to care for a parent.
Okay, so if there's only one elder care parent and FML was awarded for a distinct disease process, then can I get elder care for that one parent for other issues?
But you only can have one award per year. So you could have, the elder care is good for up to 2 weeks. They have multiple things going on. You would use that elder care for any time you're off on FML for that parent. You don't get a 2-week award for every different type of condition. So
Okay,
it's
so
so
if you applied for a particular condition and that expires, can you apply again for that same condition?
oh, I'm sorry. No, it's got to be a unique. You've already got one award.
Okay,
It has to be either for a different parent or the serious health condition has to be unique uh, from any other awards, and it has to be really spelled out on the FML application.
that's a really good answer to that. I get that a lot. Okay,
Mhm.
so for FMLA for chronic illness, does the form need to be resubmitted every 6 months, or is it good for an indefinite amount of time?
It depends. So we have probably in the last probably 2 years, we have some conditions, and the FML team's got a list of things that we can approve for up to where you'll have to recertify once a year. Other conditions have to be every 6 months.
Okay, and I think we've answered this, but it's asked in a different way, so I just want to be sure. If you use the 2 weeks elder care leave for one parent and the other parent becomes ill, can you use elder care again?
If it's for a different parent, yes.
Okay. Um, Says I work in healthcare and have to schedule my time off ahead of time as if at all possible. How do I apply my FMLA and elder care leave that has already been loaded when I take time off?
Work with your local manager or workforce management, and they can help get those hours applied to your time card.
Okay. Let's see here. What specific details need to be included on the FMLA application for parental elder care leave to ensure that the doctor completes it correctly?
I don't know if I can answer that. Every situation is unique and different. That might be a good thing to reach out to my office or one of my FML teammates to get that answered for you.
Okay. My father's doctor outsources their FMLA application completion to a company called Vital Chart. Where should they fax the completed FMLA application? I am staff, not faculty.
There's a fax number on top of the application, so there's two numbers. They can fax it to either one of those.
Okay, great. Um, let's see. I'm interested in taking a longer leave for parental care to help them move into a different home. That's the question. I mean, it's 2 weeks,
I mean,
right?
two weeks is all you can get on the elder care. You know, it's just like any other leave. If they wanted to extend that, they would just have to work with their leadership and see if they can get that approved.
Okay. I think let me see if there's anything. There's some new ones in the chat. Let me go there. If you use the 2 weeks elder care leave for one parent and the other becomes ill, can you do it again? Yes, we already had that question. Okay. If I am using TDL or for FML, but would rather use paid elder care leave, is that an option?
Yes.
Okay. What's the difference between FMLA family and elder care? Just doesn't get clear, does it?
Not exactly sure how that question's being
So I guess you could say who qualifies as a family member under FML?
Well, under federal regulations, it's going to be for a parent or a child or a spouse. Elder care would be used for any time you're dealing with the parent. So again, family medical leave by itself is unpaid leave. The elder care program and the paid parental leave programs are additional buckets to draw from while one's out. And I know we talk about them like they're two different things, but they run concurrently and one supports the other.
Okay. Are FMLA call-ins the day of subject to UKG/Chronos occurrences according to the attendance policy?
It very well can be. You need to follow your department uh, rules and regulations when it comes to calling out. Like I said earlier, some places, especially in the hospital, may have a 2 or 3 hour window that you have to notify. But having FML does not negate that process.
Okay. So I think you just answered this, but I'm going to ask it again. Is there any type of leave specified for a spouse with a chronic illness similar to the elder care leave?
I mean, you can always use TDL time for a spouse, yes.
Okay.
There's not a separate program per se.
Will these benefits, and I don't know who this is directed to, will these benefits apply to staff that are being transferred to Beyond Blue on July 1st?
I am not 100% on that one.
Anybody else?
Since FML is a federal program, that would apply. But the details of those benefits, I don't have either.
I do know from being on that team for configuring that the plan is any employee being transitioned to Beyond Blue that's currently an existing UK employee will have the same leave policies.
Do I have to come back to work after 12 weeks leave if I have remaining TDL or PTO after those weeks?
Well, the 12 weeks will be, that's when the FML would called exhaust, or that time has ran its course. If you're needing more time than off, you would have to again work with your local leadership team to see if they would approve that additional time away.
Are there opportunities to request work from home days after the birth of a child?
Some situations, yes. Again, work with your local leadership. There are some rules and regulations when it comes to hybrid remote work, what you're supposed to be doing. I know on the campus side, there's a lot of conversations about should not be using that for childcare or elder care. You're supposed to be, when you're working remotely, doing your job 100%, not being distracted by anything else in the house.
Okay. This one is a little complex. So elder care and parental leave fall under FML if you qualify for FML. If you do not qualify for FML, you can still qualify for elder care and parental leave. Coding for use would be EC or PL unless FML and then FML-EC or FML then -PL. This is a coding question, I guess.
Um, I am not sure on that one. Um, but the simple answer is yes. I mean, if you don't qualify for FML, if you've not been here a year, you would still potentially could still qualify for the paid parental or the paid elder care programs. How those show up in whatever, either UKG or SAP, I would have to do a little research on exactly how those codes come across.
Okay. I think we've kind of covered them. Let me see. There's a couple new ones. I'll see what they have to say. Just putting this back, I think it was overlooked accidentally. Can the parental leave be for the same condition if the condition has significantly increased or worsened?
Really depends on how the healthcare provider documents it. So it needs to be really spelled out for us so that we understand when we compare one application from the other.
Okay. Will we be getting more additional days for well-being?
I have not been advised in anything additional past the 2 that's already been provided.
Okay. How do you get the buckets for paid elder care leave to use them if I have FML?
Our office would work with IT to create those if you're eligible for those. So we send a file to IT, they do their magic, and then those hours will start populating just like your sick, vacation, holiday time do. You'll see a column out there, it'll say elder care or parental leave.
Okay. Well, I think that completes our questions. We're close on time, so I want to thank everybody for submitting those questions. They'll be included in the recording. And you can also, if your question wasn't answered, you can certainly call the FMLA team. Azetta has put the survey link in the chat. If you'd be so kind to do the survey, that would be great. And can we email Chris Dudley directly?
You can. I am working 3 different areas right now. Probably best going to one of my admins. Because I'm scared if you email me, it'll just get lost in the shuffle right now.
Yeah, I appreciate that, Chris. Okay, well, thank you to our panelists, everybody for contributing, and for everyone that joined today. You'll be getting a follow-up email with the link, and we really appreciate that you took your time to find out more about these pretty complex benefits. All right, thank